sexuality, and we talked a little bit about this in the fall as far as how it's important to address that holistic patient and their complete being, and part of each individual is sexuality. And we know that it differs depending on each individual, how they express that, what their preferences are, their beliefs. And so you have to take that into mind and consideration when you're taking care of different patients. I have my dog assistant down here, so you may hear him shaking. Sexuality is a part of us from birth to death. So if you think about when a mom goes for her first ultrasound, what's the very first question she asks? What is it? Is it a boy or is it a girl? And that's part of sexuality and that sexual identity. So it starts before that child even comes from the womb, or right at birth, if they don't choose to know what sex the baby is before delivery. And it goes all the way to the grave. So cradle to grave, we need to be considering sexuality. So even patients that are older or incapacitated, and you may think they probably are not sexually active, you may be surprised. And so that's something that you're going to need to assess on those individuals as well. We know that sexuality as a concept is very multifaceted and very influenced by other things. So things such as social norms, and we talked a little bit about that in the fall, about each culture and social stratus kind of views sexuality in a different way, in what's considered normal and abnormal, and that changes over time. So you have to consider that. There's quite a few religious influences on sexuality. So depending on your patient's religious beliefs or practices, that may certainly impact how they express or have sexual beliefs. There's some psychological components as well, particularly when we start thinking about abuse or previous experiences that could be negative or positive in relation to sexuality. One example would be if you've got a man who's coming into the office and he's having issues with erectile dysfunction, which we'll talk about here in just a minute. It may be that he's now having issues because he is now had the loss of his wife for 30 or 40 or 50 years, and his life has been upended, and now he's had to restart over in a different setting, in a different scenario. And so all of that plays into it as well. So it's not always just negative things. So it can be positive as well, but there is a psychological component that we have to consider. And then physical aspects as well. So if you think about people that are have some disabilities or some limitations, that can play into it as well. Physical attributes that we look for in others, that we appreciate or enjoy, those differ by people. So what gets one person excited is not going to get somebody else excited. So just keep that in mind. It's very, very personal, very, very individualized, and so you have to treat it that way when you talk to your patients about sexuality. And it's highly personal. So if somebody's coming to you to talk about something related to sexuality, they've probably waited a while and tried to problem solve and fix the issue on their own before they've ever come to you to look for help, because it's embarrassing for patients to talk about that. So just remember that it's highly personal and it's difficult for patients to talk about that. So if they've come to you and brought something of a sexual nature to your attention, or asked questions or have a concern, keep in mind that they have probably thought long and hard before they brought it up. So they are really feeling trusting of you if they do bring that up, and probably feel a little bit uncomfortable. This is where we get into that poker face that I've talked about before. So no matter what they tell you, the little nurse in your head may think, oh my goodness, that's wow. But you cannot show that on your face. You can do that when you leave the room. But if you violate that trust, or if you show shock or surprise or distaste, they're not going to say anything else to you. You have closed that door, and you're not going to get any more information or be able to help them in any other way, because now you violated that trust. So poker face comes with practice. You can start practicing now. Patients will tell you all kinds of things that you never probably knew you were going to hear. And that's okay. That's their individualized sexual preferences. That has nothing to do with you. You don't have to participate or condone those activities, whatever it may be. But you are there to help them in whatever they need to be addressed. So just keep that in mind.